My name is Binu Jacob, licensed associate counselor and patient navigator for the Rutgers Cancer Institute of New Jersey and ScreenNJ. So I'm here to talk about the benefits of deep breathing when you're feeling anxious or stressed. So you can't be anxious and relaxed at the same time. When we are feeling anxious, our breathing becomes shallow, fast, our heart rate increases, and muscles become tense. When we are feeling relaxed, our breathing becomes deeper and slower, and we can feel the symptoms of anxiety drift away. There are many benefits of deep breathing, including both physical and mental benefits, especially when practiced regularly. So here are just a few. So stress reduction, it reduces symptoms of anxiety and depression. It improves focus and concentration, and it lowers our blood pressure. So deep breathing, it's a relaxation technique that involves purposefully taking slow, deep breaths. You can do this technique anywhere and everywhere. In the car, on the bus, on the train, in the waiting room at the doctor's office. It's free. It involves inhaling deeply through the nose and filling the lungs and abdomen with your breath, and then exhaling slowly through the mouth. So let's try together. Just a few notes. So find a number of seconds that works best for you, whether that's inhaling for 4 seconds and exhaling for 8. So find what's the most comfortable and calming to you. Just listen to your body. Find a comfortable place to sit or lie down. Close your eyes, or you can focus your gaze gently on a fixed point. Take a deep breath in through your nose, slowly counting to 4 in your mind. Note how your belly is expanding as you inhale. Hold your breath for 1 to 2 seconds. Exhale slowly through your mouth, counting to 8 seconds in your mind. Pause for a few before starting the next breath. Repeat this deep breathing for a few minutes. Focus on your breath and feel the tension release with each exhale. So as we conclude with our deep breathing session, notice any changes of how you feel now compared to when we first began. Remember, you can always return to the state of calmness and relaxation at any time you choose, as your breath will always be there to guide you.
Hi, I'm Maciel Guzman, Senior Care Coordination Specialist with ScreenNJ, Rutgers Cancer Institute. So let's talk about mindfulness. What is mindfulness? Mindfulness is a type of meditation which allows us to be self-aware and become deeply in tune with our emotions, our feelings, or even the senses around us. So we do this while keeping a detached awareness and being judgment-free. What are some advantages of mindfulness? So mindfulness forces us to be aware of our environment and jumpstarts that part of your brain that's responsible for awareness and reasoning, and takes us out of the automatic response which tends to accompany anxiety and trauma. According to PositivePsychology.com, the more you meditate and practice mindfulness, the more the brain synapses strengthen. It's recommended that we practice this informal mindfulness practice and meditation at least 3 times a week for 10 to 20 minutes so that you can experience this benefit for yourself and enhance your neurological activity in your brain. So next we'll practice a brief mindfulness activity called the 5-4-3-2-1 technique, which has been adapted from Marsha M. Linehan's dialectical behavioral therapy. This approach can help shift you into the here and now and center you so that you can get the task at hand accomplished. Now we will demonstrate this. So start out by sitting, standing comfortably, taking in a deep breath through your nose and letting it out slowly through pursed lips. Look around the room and notice. So what are 5 things you can see? Maybe it's soft pastel colors on the wall. There's a beautiful picture of a landscape on the walls, or maybe it's the texture and the colors on the carpet. Maybe you look out the window and you see the beautiful blue skies, or that vibrant turquoise on the chairs in the waiting room. Next, what are 4 things you can hear? So I hear the sound of the ventilation system in the room, or someone outside walking around. Maybe there's a siren outside or soft birds that are chirping. Next, we'll focus on 3 things you can feel. So maybe it's the soft material of your shirt, or the gentle breeze from the vent that you feel on your face, or the plush couch beneath your back. So what are 2 things you can smell? Maybe it's the sterile cleaning products in the hospital, or the scent of your favorite lotion on your hands, or your perfume. Maybe it's laundry detergent that you use. Lastly, notice 1 thing you can taste. Perhaps it's that reminiscent taste of that morning coffee you had, or the taste of your minty toothpaste. Maybe you're fasting and it's just the naturally salty, acidic taste in your mouth. Or maybe you place your tongue on your lips and can feel some saltiness. It's okay if you don't taste anything too. Remember, we said mindfulness is judgment-free. Now that we've practiced mindfulness, what's your mindfulness plan? Is there ways that maybe you can incorporate this into your daily practices? Maybe when you're walking your dog on your morning walk, you're noticing a nice strong tree standing in the woods, or you're having lunch outside and you're noticing the world around you. Maybe you're just tuning into the tastes and textures of the food in your mouth and just noticing more.
Hello and welcome. Thank you for joining me today. I'm Kenneth Giant. I'm the Advanced Practice Nurse and Clinical Lead for the ScreenNJ Mobile Health Unit, also known as the Lifesaver. And today I'm going to talk to you about ways you can align with your medical provider. Although we are trained in the area of medicine, you are the ultimate expert over your body and the medical history. So it's imperative to make sure your appointments are interactive and that you share information about your health with your provider to maximize your healthcare experience. It is also important to prepare ahead of time of your medical appointments. Ways you can do this is by writing down questions before your scheduled appointment, any concerns you may have regarding your diagnosis, treatments, or maybe any tests you were sent for. Any clarification that you need on future goals to help set better goals. We work collaboratively with our ScreenNJ patient navigators who can work with you one-on-one to schedule appointments and can provide you with a brochure that can also address other questions that you may have not thought of. When is my next appointment? Who are you referring me to and why? And do I have to get any other tests done? All these questions aid in forming a holistic approach to ensuring that we can optimize your level of health and can also tackle your mind, body, and spirit. Thank you for joining us today, and we look forward to speaking with you soon.
Hi there, my name is Binu Jacob. I'm a licensed associate counselor and patient navigator for the Rutgers Cancer Institute and ScreenNJ. So let's talk about thought reframing. What is thought reframing? So thought reframing involves changing the perspective of a situation to create a more positive or constructive outlook. It's a technique that's taught in cognitive behavioral therapy. So it helps shift your thinking from unhelpful to helpful. This can enhance emotional well-being and better decision-making skills. So let's take a look at some examples of thought reframing as someone who may be nervous about their upcoming cancer screening appointment. Original thought: I'm too scared to get a cancer screening. Reframe thought: I know I'm scared, but I'm prioritizing my health by taking this important step in early detection. Original thought: what if they find something serious? Reframe thought: if something is found, at least early detection means more treatment options and better chance of a successful recovery. Let's look at another one. Original thought: it's going to be painful and uncomfortable. Reframe thought: maybe there will be some discomfort, but it's only temporary. It's important to remember that the goal and objective of thought reframing is not to eliminate all negative thinking. Rather, it's to develop a more balanced mindset that can lead to better emotional and physical well-being.
Hi, I'm Maciel Guzman, Senior Care Coordination Specialist with ScreenNJ, Rutgers Cancer Institute. Another technique that's helpful in getting those cancer screenings done is setting up goals. Knowing your why can help motivate you to accomplish these goals. Some activities that may help are journaling. So that's a safe way to get out all that pent-up frustration, anxiety that we have, and it's a safe place to get it on paper. So your goal setting, you want to break that down into smaller, achievable steps. So maybe it's calling the doctor's office, setting the appointment, coordinating transportation, devising a pros and cons list. So this helps balance your thinking. We tend to look at things only from the negative perspective when we're anxious, so forcing yourself to look at positive reasons why you want to get your cancer screening. Talking to a friend. This may offer a more neutral, objective perspectives on things you may be worrying about. At the same time, a friend who knows you well may be able to pull from your strengths and past experiences and triumphs. It's also more likely that you're going to commit to that cancer screening when your friend is holding you accountable and offering support. Recognize and be aware of common familiar or cultural beliefs that may be holding you back from completing your screenings. Debunking myths is important in taking control of your health and future. As a Hispanic woman, I grew up hearing a lot of these cultural beliefs that exist in the Latino community. Doing some research of your own on valid medical sites like the American Cancer Society or the CDC can help you make an informed decision about cancer screenings. You can also talk to a provider or a patient navigator who can help engage you in shared decision-making conversations.